Well, let's bring in emergency doctor James Smith now, live from here in London. Thank you very much for your time, first of all. Thank you for speaking to us here on TRT World. Now, the UN has raised these concerns of war crimes and crimes against humanity with this systematic destruction of these hospitals. Just how catastrophic is this proving to be for the people of Gaza? And what now?
I mean, the situation is beyond catastrophic. I don't think there's a way to adequately describe the extent of the destruction of the healthcare system and its consequences, not only in the short term, but over the long term. And by that, I mean years, if not decades. This will have ramifications for generation after generation of Palestinians living in Gaza. As your reporter Ashraf has mentioned, I mean, this is very clearly a systematic attempt to undermine and in many cases outright destroy health infrastructure and other aspects of the healthcare system in Gaza, including, of course, the health workforce. More than 1,000 Palestinian healthcare workers killed, many of them detained, some of them have died or rather been killed in Israeli detention. Pair that with, of course, the conditions in Gaza now, not only the plummeting temperatures, but the lack of access to nutritious food, the lack of access to safe water. This is the most apocalyptic situation that anyone could reasonably comprehend.
And on that, the floods now, the heavy rain, as well as this lack of sanitation, that must just be increasing the risk of the spread of diseases throughout the enclave as well.
Absolutely. I mean, we know that countless diseases are spread from poor quality water, lack of access to basic sanitary services. And this has, of course, been an issue now for much of the last almost 15 months. And of course, prior to October of 2023. So nothing that we're discussing here is new. This was entirely predictable. And if we understand that what we're seeing now was predictable, we can begin to consider and hopefully collectively acknowledge that this is an intentional strategy. What do you do when you want to amplify the effects of military violence? You ensure that the conditions required simply to sustain human life no longer exist in Gaza. And that's certainly what we're seeing, particularly in the north of Gaza, as we speak this evening.
And with this destruction of hospital after hospital, what of these injured that have now nowhere to go, what hope have they as each hospital is destroyed, razed to the ground?
People that suffer from, or rather are subjected to major trauma-related injuries need to access specialist healthcare very, very quickly in order to increase the likelihood of immediate survival. But then, of course, you need to appreciate that people need ongoing care. Oftentimes people need multiple operations, they need dressings changes, then of course they need physiotherapy and all sorts of other specialist services, much of which now isn't available in Gaza. There are a very, very small number of Palestinian Ministry of Health healthcare facilities that are still partially functioning in Gaza, and a small number of internationally managed field hospitals. And again, this is an important point for us to recognize. The Israeli military has, on the one hand, claimed to have supported the construction of hospitals managed by international organizations, while simultaneously destroying Palestinian-run and Palestinian-led healthcare facilities. This, again, also forms part of a wider strategy intended to undermine Palestinian self-determination and Palestinian ownership of basic social services.
Dr. James Smith, we really appreciate your time, having yourself worked as an emergency doctor over in Gaza for a couple of months. Thank you very much for your time.